listeners, welcome to the MedReach Podcast by MedReach Knowledge-sharing Forum, top-notch talk with healthcare experts. I'm your host Roshna. Let me give you a quick insight about what is MedReach Knowledge-sharing Forum. We are the only forum to focus on healthcare management knowledge sharing. Our forum helps you to connect with healthcare industry experts. MedReach Knowledge-sharing Forum is the right place to share best practices, interesting queries and articles respect to the healthcare field. To share and seek in all the fields of healthcare industry, join with us today. Visit knowledge.medreach.in. This episode, to join with us, we have Dr. Prashant Kumar Singh Chauhan to share his knowledge on the topic patient experience. He is Director Operations at Center for Sight, a group of eye hospitals, Delhi. He holds 21 years of experience in healthcare industry and he worked in reputed organizations like Indian Armed Forces Jain Hospital, Icare Hospital, Indraprastha Apollo Hospital, Vasan Healthcare Private Limited, and so on. Hello, Dr. Prashant. Welcome to the MedReach Podcast.
Thank you for inviting me and giving me an opportunity to share my thoughts on a topic which is very dear to my heart, patient experience.
Pleasure, sir. So I have given a gist about you. Can we go with your self-introduction?
So I did my MBBS from PGIMS Rohtak, and immediately after that I joined the army as a medical officer. Came out, did my MBA from FMS Delhi University, and I've had a varied experience as you have shared in both multi-speciality as well as single speciality hospitals in India as well as abroad. And currently I'm taking care of operations for the entire group of Center for Sight and have keen interests in capacity building, strategy, business process re-engineering, P&L management, and of course, patient experience.
Great, sir. So, to start with a question, what will define a positive patient experience according to you?
So we are living in an age where we no longer can be considered to be in the service economy. If you have asked somebody a few years back, we would have said, yes, we are in the service sector, but we aren't. Today, we are in something called the experience economy, which is, we share it with industries like theme parks, or you go and watch a movie. Hence, a patient who comes to us is not, buying a service from us, is actually buying an experience. And their expectations hence become that every touch point across their journey is giving them that care, that compassion, that hospitality. And it happens to him or her every time they visit that hospital. They want, an experience which has empathy, and there should be effective communication, which sometimes, either we have poor communication or we have no communication at all. That has to be avoided. People are very busy, so they need their time to be respected. And of course, they want excellent clinical outcomes. That goes without saying. They're coming to you because they want their disease to be treated at the earliest. And one thing which healthcare has been lagging behind is on, I will say, integrity and transparency. So patients are expecting things to be transparent, whether it comes to their breakup of costs or the estimates that are given. So that is something altogether which will constitute a positive and a memorable patient experience. And I think a great patient experience will generate the best word of mouth possible. There is no better way than that to get more patients to come to your hospitals. They'll give you glowing reviews, whether it is on Facebook, Twitter, or Google reviews. And that will make your brand, be perceived as a brand which takes care of the patients. And automatically you'll have more and more people who are searching for healthcare providers through the internet, which is a lot nowadays. They will come to you. So I think the return on the investment of giving a positive patient experience is immense.
All right. So transparency and everything will play an important role in this. So patient expectation is also changing regarding their experience for the past several years. Can you share some of the best practices that healthcare professionals and organizations can adopt to enhance the better patient experience?
So I had briefly touched upon, how things have changed. So if I look at 30 years ago, so a patient, a customer for healthcare was only looking at hospitals for cure. And then past 10, 15 years, it became cure and a little bit of care. But today it is cure and a whole lot of care. So they're looking for very good cure and very good care. And organizations that are doing that or focused on it are reaping benefits. So if you look at some of the hospitals had these PROs, now those have been realigned to become patient experience officers. Patient feedback, which was years ago just an accreditation documentation requirement, is actually now become the way of listening to patients and reacting to their feedback. One thing which patients need today is convenience, and that became all the more apparent during the COVID times. And people wanted everything at their doorstep. Hence, you are looking at medicines being delivered, video consultations for people who can't come to your hospital, home care are becoming the norm. And I think hospitals who are ready to pivot to these needs of patients quickly are the ones who will still remain ahead in this rat race of getting patients to your hospitals. Today, even comfort in the waiting area or having a cafeteria so that their relatives and patients can have food and snacks if they need. Adequate parking. There are many people who would not want to visit a hospital if parking is not available in the hospital. And these would not be areas which were the critical focus areas 15, 20 years ago. At that point in time, everybody is looking at clinical outcomes and nursing care, and that's about it. But today, what we used to consider as skills in the past has become the norm, and we are focusing on it because the patients are very demanding nowadays, and because they are paying top dollars, they need to also kind of get it back in return with the care that you should. And organizations who are able to do that are actually able to meet up with the expectations. And when you are able to meet and surpass, then only you will have a satisfied or a delighted patient who will want to return to you when needed and also recommend you to others.
So true. So, as we've spoken about the technologies and teleconsultation, etc., how tech is playing a role in patient experience these days?
So I would say technology is the steroid in our quest for a better patient experience, which is again, as we said, more and more care is coming into healthcare. More and more technology also is coming into healthcare. So chatbots has become the norm. So many healthcare organizations are using chatbots. Many of them are now even looking at virtual agents to handle, the call center load. We used to have paper feedbacks. Everybody used to fill up paper and used to do all the analysis on Excel sheets and then share with all the departments what went wrong and what went right. Now it's a matter of a SMS or a WhatsApp, and there's a link, and the patient can fill up the feedback on their phone or on their laptops, which has now reached out to so many hospitals. Video consultations are happening, as I talked about. Telemedicine has really taken a boom, especially in the COVID, post-COVID times. I still remember way back in 2009 when I visited CMC Vellore. They had touchscreen kiosks because it was a huge campus to help patients and their relatives to navigate through various departments and areas of the hospital. That is something people are using a lot. And I think it is helping the organizations to be able to make healthcare convenient to all. We are seeing queue management using technology. So no longer you have to, shout the name of the patient in the waiting area. They will know on the screen if that turn has come. Hospitals are rolling out apps both on, Google Play Store and iOS, and you can have your records on the apps, and you can make payments, you can book appointments, you can do a lot of things to those apps. So artificial intelligence and machine learning is, walking side by side. And you have these chief information or chief technology officers in the healthcare organizations are very busy coming up with these innovations, and they're making more and more inroads every day. So electronic medical records, people are moving from paper hospitals to paperless hospitals. Everything is with a click of a button. You have everything available with you. So And I think this is just the beginning. I foresee technology to actually play a much bigger role, and you'll have a lot of automation. A lot of things may not require human involvement, and that's going to make it not just seamless, it will be very, very consistent, and that is going to benefit the patient a lot, I feel, in the times to come.
Like a picture perfect.
Exactly.
So, how we can assess the patient's experience on what are the tools it includes? Can you share some of them with us?
So, if you look at tools, as I said, from the digital feedback is one tool in terms of taking patient feedback, no longer being taken on paper. We have toll-free numbers where people can call up for appointments. People are actually giving their feedback on those uh, on those phone numbers and sharing their happy or unhappy experiences. Every hospital has actually an email ID for feedback. You can share your feedback on that email ID, which will reach to somebody at the corporate level, and they will then escalate it to the concerned hospital or department. uh, Google reviews, I think, is the new word of mouth. I think if you are wanting to search for a hospital, you go on the internet and you search, and if you will actually go to a hospital which has a healthy number of Google reviews, and the rating also is hopefully at least 4 and above. So people are using that to make that choice of where to go. A lot of feedbacks actually come on a face-to-face interactions. You can ask for a particular manager or supervisor and share something which went really well or something which wasn't well at all. And many of the hospitals also make feedback calls. So if you have gone to a hospital, sometimes 2 or 3 days later you'll get a call which will be like asking about how that entire experience was. That's another way of getting feedbacks. We actually in our organization have a wall of delight in the waiting area where we put up some glowing feedbacks of our outpatients and inpatients, and people can look at that, and it gives them that sense of comfort, and they can trust and have faith that they have chosen the right place. So NPS, which is the Net Promoter Score, is actually the, I'll say, the gold standard of measuring patient experience or taking the feedback. And you come to know from that one question how likely is the patient to recommend their friends and family to your brand. And it's analysis of that and taking course corrections wherever things go wrong is the key for all healthcare management professionals.
There was actually a brilliant idea, like displaying the feedbacks and all. It was so impressive. So patient can feel that connectivity and trust towards the organization.
Exactly.
So does COVID have an impact on patient experience? How was the pandemic and the patient experience?
So when we had the pandemic and the peak of it started from March, first of all, a lot of the patients stopped coming to hospitals except for emergencies. They were very scared because I think the first thought in their mind was they might come for some other disease, but they'll go back with COVID. So they reduced it uh, to a huge extent. But when they started coming back, I think the biggest concern for them was, are the hospitals taking adequate precautionary measures when it comes to COVID? I think that is something which needs to be there. People have to put signages, and people have to, actually, like, literally shout from the rooftop that we are taking all the precautions which are necessary and have them evident. It should be visible for people that they're actually doing that. So we have screening desks where patients are screened at the entrance, their temperature is taken, and they fill up a form and they talk about their travel history and exposure. So that when you are getting people to come inside, you have that sense of security or safety that they are most likely not infected. Waiting areas also have become sparse. We can't have people, sitting together. Social distancing is something which has to be applicable. So I think people are very particular about that, and they get very uncomfortable if they see hospitals and waiting areas which are very crowded. And mask protocol is something which more so than any other place in hospitals is something where we keep reminding our patients and attendants if they are not having their masks up to actually ensure that. Visitor management has become very stringent. You're not allowing too many attendants and visitors to come to the hospital so that you can maintain those social distancing. And I think the hospitals which are able to give evidence of it in their practice are able to gain that confidence of patients that yes, This is the place that I should feel safe and I will be taken care of, and I will not go home with an additional infection. So I think the hospitals are able to do that. So I think a lot of training and development and reinforcement of training of the staff, especially with the COVID protocols, is something which need to be done to ensure that these practices are happening on ground without exceptions, and giving confidence to the patients.
All right. So today, like there are many non-clinical people in leadership roles, and what qualities should they improve to increase the patient experience?
I think the biggest quality that I would like to recommend is that they need to be active listeners. I think one problem that we've had in this day and age of hurry and worry is that we don't have time for people, whether it's in our professional or personal lives, and we don't have time to actually listen. So a lot of the time, the patients want to share their story, they want to talk about their experience, but we're always in a hurry. I think active listening is, I think, something which every healthcare professional should have, and especially people in leadership roles, because so that they can lead by example and ensure that such practices are there with every team member that they have. They need to lead by example. So whatever they want their team members to do, they should be doing before them. And on the ground, they need to be, I think, the best managers are not managers who work out of PowerPoints and Excels or from their cabins. They are the ones who actually are there with their team members on the ground. I think that is something which will motivate the team to deliver beyond expectations. I think empathy is something which we are not even taught. I'm a doctor myself, but I wasn't taught empathy in our medical school curriculum. I think, but we need to be empathetic to the core, and we need to ensure that each and every touch point of the patient shows empathy to them. We as healthcare leaders also need to have the capacity to innovate. So COVID was an inflection point, and a lot of the companies moved ahead because they had the capacity to innovate and pivot when the need arises. I think that thinking of out of the box with innovation is something the leaders should be able to have, so that their companies can make these changes when needed. Have the ear to the ground and listen to everything that is happening, and take corrective measures wherever needed. And I always see that everybody says we need to be patient centric, patient first, but I truly believe that it should be employee first. Because a happy and a motivated staff will anyway ensure a happy or a delighted patient. And as we talked about, technology is going to make more and more inroads. So leaders have to be open to technology and automation in the patient journey. And if you are non-clinical, the first step that you need to do is understand healthcare before you try to change it. Many people want to change it without even understanding healthcare. So if they're able to do that, they'll make the right moves and the right changes. Because a lot of half-baked knowledge has crippled many good systems by hack jobs done by some inexperienced non-clinical administrators.
As you told, that people are trying to change the healthcare every time before they do understand well. So, if you want to share your message for upcoming hospital management professionals, can you add little more about it?
So when you are, moving out of your B school after having done your MHA or your MBA, everybody needs to be sure about what their why or their purpose is. Why are they in healthcare, and what is their why? And join an organization which connects to that same why, that same purpose. And I think if it is not in sync, you will certainly find yourself very suffocated, and you'll have a very miserable experience and probably leave very quickly. So join a company whose value system and purpose matches with your own. One more thing which people do is that all the time we are running after authority, because that is what we think, that as managers we have authority over 500 people. I would always kind of tell them that don't run after authority, run after influence. Your legacy which you leave behind in an organization will not be what how much of authority you had, but how much of influence you were able to have on people and touch people's lives and make them better. Be a mentor and groom them for the next role. If you're able to do that, you will be fondly remembered for a very long time. Be ready to push the envelope and stretch yourself. be a hustler. You have to push yourself, and that is something that I think you need to do that from day one. And in the beginning of your first job, look for the culture of the organization, whether you have a mentor who will be able to teach you. Role and growth opportunities are more important than money. Money will follow, don't run after it. It will come to you. Go for the right culture, the right mentor, the best role and growth opportunities. And eventually, if you make decisions based on them, good things will follow. And even within the hospital management, be clear about what stream you want to get into. There are many streams. You could be joining HR, operations, business development, marketing, supply chain. So find where your interest is, and if you have done your internships, you will find what connects best with you, and based on that, make an informed choice and stick with it.
That was wonderful message. We are almost at end of the podcast, and the final question: can you share your favorite book and a person who inspired you the most throughout your journey?
So rather than one, I would give a few books, because I think reading book for a management professional is a wonderful habit. And if you look at the best of CEOs, they would probably read about a book a week. But that's a habit I would want people to inculcate. So I would start with the book, which is Start With Why by Simon Sinek. I'm a huge fan and follower of Simon Sinek, and I would request people to watch his TED Talks and read his books. And I think it talks about how you should actually begin with purpose and follow it. And that's something that we should be at our core of every decision. And if you're able to do that, then we can have, wonderful associations and tenures in life. And the other one, I think I'm a big fan of Nelson Mandela and what he stood for and the struggle that he overcome to reach to where he reached. And his autobiography, Long Walk to Freedom, is one of my favorite books. Very, very inspirational. And another book I would say is Paulo Coelho's The Alchemist. I think some wonderful lessons, life lessons, I will say, that one can learn from that book. In terms of people who I look up to and have been inspired by, so if I say healthcare, then I've had the privilege of working in the organization and being around him for a while. Dr. Pratap Reddy of Apollo Hospitals, I will call him the father of Indian corporate healthcare. So where we are in corporate healthcare is because he decided to come back to India and start the first hospital in Chennai. And Mr. Ratan Tata, I think everybody looks up to him, and he has been with his father and himself, has taken the Tata name to such high standard when it comes to ethics and integrity, and that is something we should all imbibe in ourselves and our businesses. And Michael Jordan from the sports, I think his hunger for winning is something I'm always looked up to, and I feel that if we can have even a fraction of that, we'll be able to do so well in our lives. And because we're in healthcare, it's a sector where we should have compassion. And I have had, again, the fortune of meeting Mother Teresa, and she is someone that all of us look up in terms of her compassion for humanity. And if we're able to do that, we would be actually doing justice to being in this healthcare sector that we have joined.
Oh my God, I think you're really blessed to see her in the person. We are done with our podcast. Thank you so much for joining and sharing your knowledge with us today and your valuable time through MedReach. And this is a new topic and completely new knowledge. And thank you so much for giving us in very crystal clear manner.
Most welcome. It was a pleasure. And you guys are doing a fantastic job in terms of reaching out to people and having their thoughts and voices reaching out to the common public. And I think this will inspire people to come up with new ideas or looking at new ways of looking at things. And wish you and your venture the very best. And thanks again for inviting me.
Thank you so much, sir. If you wish to bring one guest to this podcast, whom would you recommend?
So this is a dear friend of mine, Commander Navneet Bali, who's Director Northern Region for Narayana Health. I know him for past few years, and he could be somebody that I feel that you should invite on one of your podcast sessions.
So sweet of you, and thank you for recommending him. Waiting to extract the knowledge from your colleague. Thank you so much.
Thank you. Bye-bye.
Bye bye. Hello, listeners. If you want to ask any questions regarding this episode, follow the topic in our MedReach Knowledge-sharing forum. Thank you for listening. Hope you all enjoyed the session. Keep gaining the knowledge with healthcare industry expert by MedReach Podcast through MedReach Knowledge-sharing forum. Until the next episode, take care.